happy to welcome you to today's first National Students' Health Conference that is themed Students at the Forefront. And with that, we want to explore how innovations and solutions for SRHR, mental health, HIV, and GBV, how we can put it at the forefront. This conference is for us as young people, as students, as the next generation, to come up with ideas that can inform tomorrow's policy, that can inform tomorrow's leadership landscape, that can inform the next phase of innovative health in this country. And that's why On Your Future initiative is interested to see that we work with young people.
On Your Future Campus initiative was launched by the First Lady, Mama Janet Kataha Museveni, who is also the Minister of Education and Sports. And we were launched to specifically address health challenges that young people at the university face. And our focus is on GBV, gender-based violence, sexual and reproductive health, HIV, and mental health. And because of that, that is why we gather here today, stakeholders, policymakers, young people and students in the different universities to address these challenges, but to also give you a chance to network and share with these stakeholders who are available here today.
As Dean of Students, I am delighted to welcome you all to this important event. And today we gather here with a shared commitment to prioritizing student health and well-being. Students are the driving force behind innovation and change on our campus environment, and I am excited to see the creative solutions and ideas that will emerge from this important conference. As we gather here today, I'm excited to see students taking the lead in driving innovation and solutions to health challenges. Let's build our progress, share our knowledge, and collaborate to create a healthier, more supportive, and inclusive environment for all students.
When I became the Minister of Health, my specific interventions were specifically to HIV and SRHR, and I followed up some information, statistics from the HIV fact sheet that was released by the Uganda AIDS Commission. And Gulu district HIV prevalence was at 7.2%, Gulu City at 10.5%, of which both were higher than the national prevalence. And this one raised a very, very serious challenge and a question to me as a minister, coming from the same region that was affected. So those are the statistics that we had, and we needed to create awareness to the students and the entire population.
So we are looking at having the Health Initiative Overview Clubs, and our ask is simple, that we look at having an avenue where young people can then approach decisions other than fearing to face people face to face, but through services that they can use initially to make sure that they enable them to access services. One, we are looking at having accessibility of services, mobile services where young people can approach. Through, we are looking at also establishment of online apps, SMSs, for example, those that are in far-reach areas. And thirdly, we are also looking at an avenue of young people having these what we call barazas or home presentations where they face to experienced people that help them in guiding them. We are looking at also having setups for young people where they can then make innovations to solve their own issues, whereas service providers in the SRH community are trying to help them. But we are looking at an avenue where they are being helped and being solved. We are looking at having an equalization of targeting both central universities, eastern universities, and also other outside casts of the central.
It is such an honor to be here today, and I want to thank the Own Your Future campus colleagues who are launching this very first Uganda National Students Health Conference. It is really a privilege and a pleasure to be here present for this very, very important day. Today's event reminds us of the critical role that young people play in shaping the future of our society. As our keynote speaker noted earlier, and I think we all recognize, Uganda is amongst, if not the youngest country in the world. And so you are a testament to the reality that young people are shaping the future of not only this country, of this continent, but of the entire world. And it is in this spirit that the United States has focused our engagement on so many different health issues, in particular HIV, on young people. By collaborating across sectors, collaborating across academic disciplines, collaborating across ministries and institutions and organizations, government, non-government, private sector, etc., we can collectively support communities, empower them to also be part of the fight against HIV and all the other challenges we face. We obviously have to embrace innovation. We have to embrace the participation of all, be inclusive, specifically for young people, and to really achieve lasting impact, make sure that we are dedicating not only the resources, the knowledge, and the know-how, but also all of our voices together working for a solution. And it is in that spirit that I hope that all of you will take full advantage of today and tomorrow's discussions. Through this exchange, I hope you will leave further inspired and further engaged to contribute to this effort. You will continue to contribute your voice to this ongoing work that still needs to be done. We are not in a sprint, we are in a marathon. We've accomplished a lot, so now more than ever, we need to recommit ourselves, continue to engage, continue to exchange, continue to use the knowledge that I hope you'll gain today and that you'll share today to move forward to a lasting goal, particularly in the case of HIV, which is epidemic control by 2030, but also solid, sustainable health solutions across the public health sphere.